Hi, this is Shelley Kraft. We're coming to you live on SNNLive. We're at the 14th Annual B.Riley and Company Investor Conference here in Santa Monica, California. I have with me Boyd Gentry of AdCare Health Systems, publicly traded company, and the symbol is ADK. Boyd, welcome to SNNLive.
Thanks, Shell.
It's good to have you. I want to get an overview, please, first, and then we'll go on.
Sure. AdCare is a company in the healthcare space. We operate long-term care facilities, primarily skilled nursing facilities in the Southeast.
So, the aging of America is a feeder system. Boy, you must be busy.
Yes, sir. I mean, it is really the aging of America is happening. We're all getting older, and that does drive demand for our business.
So what's the feeder? How do you get your business? Where does it derive from?
Sure. Most directly, people come to us from an acute care environment, so they come to us from a hospital, but what really drives it is typically an event in an older person's life. And so that event could be a fall, a broken hip, might be a stroke or some other event. They spend time in the hospital. They are in essence medically stabilized, and then they need maybe a month of therapy before they can be discharged back into their home, the home of their adult children, assisted living, and the like. So they really come through the hospital into our facilities.
So this generation that I guess I'm a part of, as we look around as to making choices out there, I guess it's a family decision, and then they're advised by their doctors and the hospital. So it's a pretty much all of that decision making. And then we have to talk about reimbursement. So handle it any way you want.
Sure. Now, truly, the decision is usually made by the hospital. Hospital is very much involved in that decision, and local reputation does factor in, and obviously loved ones play a role. On the reimbursement front, by the time you get to the skilled nursing environment, the primary payer is the federal government. All Americans 65 years old and older have Medicare, and so Medicare is the primary payer for our true healthcare services. We're also in a custodial business where those individuals that can't be taken care of in any other setting, their needs are just too great to be in an assisted living or at home. Those custodial residents, the primary payer there, also the government, but really it's Medicaid in most cases.
So now, I know you're headquartered in Atlanta. So what are your pockets of real estate where you would be known best in the market?
We've tried to focus really on what I would call second or third tier SMSAs. So while we, as an example, have 6 facilities in Atlanta, Atlanta's the 4th largest SMSA in the country. It's a huge market. It's difficult for anyone, not only myself but even my larger competitors, to truly dominate in a market. So we've tried to focus more on the next smaller down of cities in the Southeast. So Little Rock, Tulsa, Oklahoma City, Savannah, Georgia. Those markets are markets that we can truly dominate with maybe 4 or 5 facilities, and that's really our primary focus, is to take on those second and third tier SMSAs.
Now, you've been growing the company organically and probably through acquisitions.
Yes, sir.
How do you see the future? And please tell our investor audience what your thinking is on that.
You bet. In our business, the growth in your footprint comes through acquisition. So it's not organic on the skilled nursing side. There still is a significant amount of construction in the kind of next market down, assisted living. But on the skilled nursing side, it's a licensed provider that you need, and so that is truly acquisition. So we are an acquisitive company, and we focus acquisitions in those markets I spoke about earlier.
Now, I don't know, this just came to mind, and I thought it's an important question. How is the market for employees and professionals in these various markets? Because I know that there has been a shortage of nurses? I just think that that's a pretty good question that somebody might ask.
Sure. Over the years, there have been shortage of nurses. Actually, now it's not as bad as it was several years ago. The last stat that I recall is that the average age of a nurse in this country is 60 years old. So that's incredible. It's almost like the Hair Club president. These folks are going to be our residents, soon. But the acute care environment, so the hospitals, have recently changed their licensure requirements. So what I would call kind of the second tier nurses, LPNs, LVNs, so not registered nurses, RNs, but LVNs and LPNs no longer can get as many of the jobs as they could get in the hospitals before. So that level of nurses is now really available to us more. So that nurse shortage is focused on the hospitals, which require a registered nurse, an RN, to provide that care.
So now remember, this is an investor audience we go to.
Sure.
So the next question that I have is, what is the average stay of a patient?
You bet. There's two different patients, right? So that custodial patient, the end-of-life patient, and I respectfully refer to their discharge as the celestial discharge. That individual, on average in the country, is 82 years old, and they stay with us for a year. Many residents might stay with us for 5 or 10 years, but on average today, 1 year. So it's the end of life. A significant number of things happening at the end of life. The short-term stay patient, so that individual who's getting primarily therapy, so they may be getting physical, occupational therapy, their average stay is 30 days.
Thank you for that answer. Ladies and gentlemen, let's get a website for you to get more information. Go.
www.adcarehealth.com.
Easy enough. AdCareHealth.com. I'm Shelley Kraft. This is SNNLive. This is Boyd Gentry of AdCare Health Systems, a publicly traded company, symbol ADK. We are at the B.Riley and Company 14th Annual Investor Conference right here in lovely Santa Monica, California. Thank you so much for coming on to SNNLive.
Thank you, Shell.
Good to have you.
Mm-hmm.